Up next on The Reveal.
That's the last place I want to end up. Had I not called 911, I 100% would have died.
Afraid to go to the hospital during this pandemic? Why doctors are sounding an alarm.
It was really scary, and I tell you, I cried every night.
Fears over the coronavirus have a Georgia mother pleading for her son's release from a juvenile prison.
I couldn't even move my arm. I mean, I couldn't lift it up.
And how a Reveal investigation helped diagnose her condition. Now she faces another potential battle. From our Midtown studios in Atlanta, The Reveal begins now with our multi-Emmy and National Mural Award-winning team of investigators.
Welcome to The Reveal. I'm Faith Abube. The medical community and healthcare systems have been some of the heroes of the COVID-19 pandemic. But despite their hard work, many have still been impacted financially by this crisis. Thousands of healthcare workers are even being put on furloughs. The reason? Hospitals have been losing money in many ways, including having to put off some routine procedures during this pandemic. And in some cases, it's the patients who are choosing to stay home from the hospitals, even in cases of emergency. And that has doctors sounding the alarm.
I was baking banana bread and I started to feel like some chest discomfort.
Danielle Denlin remembers it like it was yesterday and not 12 years ago.
It kind of felt like heartburn at first.
Next thing she knew, she was in the back of an ambulance. Denlin was having a heart attack at just 35 years old.
Having a baby and then having a heart attack 5 days later when you're completely healthy, this massive heart attack came out of nowhere.
Had her symptoms appeared in the middle of the COVID-19 pandemic, she says she would have been concerned about going to the hospital so soon.
And that's the last place I want to end up. But I know for sure it wouldn't be an option. Had I not called 911, I 100% would have died.
But anecdotally, cardiologists and other doctors are reporting an alarming trend in the middle of the COVID-19 pandemic. Doctors, including Wellstar's Dr. Barry Mangle, say the number of patients coming into hospital emergency rooms for strokes, heart attacks, and other emergencies have dropped significantly.
Across the country and really across the world, a lot of informal polls have suggested to us that there's about a 40 to 60% reduction in some of the emergencies that we normally see, including heart attacks and strokes.
Under normal circumstances, that would be good news. But doctors don't believe the drop is because there are fewer emergencies happening.
It's our concern that people may be staying home rather than risk coming to the hospital during the COVID pandemic.
This is also evident by some of the stories that we're hearing from physicians and nurses of patients coming into the ER, and they actually have had episodes a day, 2 days, 3 days.
Kristen Kyle with the Georgia chapter of the American Heart Association says, with heart attacks, time is critical. The longer you wait, the more heart muscle you lose, and it can't be recovered.
It's a concern for sure.
Just ask Danielle, who did everything right, and still.
I ended up losing 40% of my heart muscle because it took that long technically to get to the hospital, and every minute counts.
These are emergencies. These are not, paper cuts. They are not twisted ankles. Emergencies just don't stop for COVID-19. So the message is really know the signs and symptoms and call 911 if you or a family member or friend are experiencing those.
And those symptoms can vary. We have the most common ones listed in the story on 11live.com.
Crime in Atlanta is down double digits in nearly every category since the pandemic. But where society sees crisis, some criminals see opportunity. One Midtown business has hired its own police force to combat thieves who aren't afraid of getting caught.
And there goes the customer, jumps on the hood.
And he proceeded to get up, chase his vehicle, and step in front of the vehicle. At that time, the juvenile then put the vehicle in reverse and then gashed it forward in an attempt to run over the individual who owned the vehicle.
This isn't file footage. It's Midtown Atlanta in the middle of a pandemic.
I mean, desperate times are definitely calling for desperate measures.
Jeff Whitmire is not with the Atlanta Police Department. He's one of several heavily armed private security officers with tactical protection specialists hired by Dean's Midtown gas station after a rash of crimes in the neighborhood.
I was able to detain 2 adult males for charges that required an arrest and for transport to jail. But due to COVID-19, they were issued summons and a court date. And at this point in time, the earliest court date is July 28th. So you're talking about upwards of 3 months before they even have to proceed to a courtroom.
A drug deal turned into a shootout at the gas pumps in February, followed by multiple attempts to steal customers' cars.
We actually saw these incidents occurring before COVID-19. They're occurring more often now because school is out.
Teens are walking into the store and walking out with handfuls of merchandise. County jails are no longer accepting shoplifting suspects and even many accused felons.
Because of the coronavirus, the criminals are taking advantage of the system. They recognize and understand that if they are arrested, they're going to be taken down to the jail. They are not going to be processed. They're going to be given a written summons to appear in court at some later date.
And this private army of guards is seeing the same thieves again and again.
And these are the 2 ringleaders. They were back today, the same day they stole his car.
The owner of Dean's Midtown wears a gun on his hip, but that's not stopping multiple crimes a day from literally walking up to his front door.
These criminals understand that unless they draw a gun and point it at the owner or any of the employees or one of the security officers or an off-duty police officer, they're not going to have anything happen to them.
It was bad in the 90s. In all the years I've been here, never have seen it this bad.
The police are not to blame, they say. It's an already strained justice system, now with mandatory release of suspects.
This is not an issue for the APD. They're doing their job, making sure that these criminals know that there are repercussions. And unfortunately, during this particular crisis, that is not the case.
Atlanta police crime stats through May 23, 2020 show murder is down 11% over the same time last year. Burglary is down 27%, robbery 26% lower than last year, and theft is down 14%. The only category that is nearly steady over last year is aggravated assault, as people have been in lockdown with others in the same house.
Coming up.
I look at it this way. It's called the My Child test. If this were your child, how would you feel? And as a judge, that's how I see every one of these kids.
The Georgia Department of Juvenile Justice has released more than 100 children from youth prisons in response to the pandemic. Some employees have tested positive, dozens quarantined since March. One judge tells us what he's doing differently in court to limit exposure.
We've never been through anything like this ever before.
Arlena McDew believes her son was at the wrong place at the wrong time when police arrested him for a nonviolent offense this past March. Still, a juvenile court ordered the 14-year-old to serve time at this detention center in Hampton, Georgia. Already nervous for his safety, her anxiety grew when the coronavirus spread.
It was really scary, and I tell you, I cried every night.
A few days later, Clayton County Court Judge Stephen Teskey reviewed her son's case and released him after determining he wasn't a threat to his community. Last month, the judge issued an order limiting the number of youth detentions to only violent offenders in his jurisdiction.
I look at it this way. It's called the My Child test. All right? If this were your child, how would you feel? And as a judge, that's how I see every one of these kids.
Over the past few weeks, DJJ and juvenile court judges have released 99 minors early from Georgia's youth prisons in response to the pandemic. Those released are under increased supervision, wearing ankle monitors or moved to treatment centers.
So it's not just simply the virus itself, it's the fact that we're keeping teenagers, children, locked up in a jail cell for an extended period of time, which, you know, that's going to aggravate their psyche.
McDew says releasing her son and others was the right thing to do.
The gratitude's just, the words can't describe how I felt in that moment.
Since our story originally aired in April, at least 3 children in DJJ's custody contracted the virus and then recovered. The agency is still only testing children who exhibit symptoms.
Coming up.
In HHS's own research, they're the ones who identified this injury.
So why is the government secretly trying to eliminate a program it designed to help?
Thousands of people have turned to a little-known government program that can help pay your medical bills if you're injured while getting a flu shot. The program is designed to help avoid lawsuits and maintain public confidence. But just as we prepare for a new vaccine to fight COVID-19, the government is trying to remove those protections. And some argue they're using the pandemic as a distraction to do it.
It's really difficult.
Recovering from cancer, Debbie's doctor encouraged her to get a flu shot. But as soon as that needle entered her arm, she knew something was wrong.
I couldn't even move my arm. I mean, I couldn't lift it up.
For nearly a year, she struggled to do the most basic tasks: buckle the seatbelt, launder the clothes.
I went through a lot emotionally and physically, and it was very difficult.
It just hurt so badly.
No one could explain her muscle weakness or pain.
Up next on...
Until she saw this segment on The Reveal.
It was just constant pain. I can't get my arm around.
My husband and I looked at each other and said, holy Toledo, this is a thing. And everything you've gone through, everything you've described is legitimate. It's not in your head.
That segment exposed a program issuing payouts to people with SERVA without holding the people who caused the injuries accountable. No notification, no retraining. SERVA stands for shoulder injury related to vaccine administration. It is caused when the flu and several other types of shots are given too high or deep.
In HHS's own research, they're the ones who identified this injury.
In the 3 years since the U.S. Department of Health and Human Services added SERVA to the vaccine injury program, it has paid out $162 million in claims. But now, HHS wants to stop those payments.
It's only now that we're seeing more and more cases being filed that you're seeing them make an about-face and try to remove SERVA from the vaccine injury table. Nothing has changed. The science has not changed.
The Advisory Commission on Childhood Vaccines, which watches over the program, learned of the proposed change when it received this confidential draft. Instead of public hearings, HHS wanted them to quietly offer written recommendations. That didn't sit well with some board members.
I read that packet, and quite frankly, I was stunned.
Last year, HHS told The Reveal it had no intention of removing SERVA from the program. But we filed an open records request anyway for emails and internal memos related to the program. HHS sent us back hundreds of pages of redacted documents. And a year later, the Department of Justice has yet to send us anything.
It's not a fault of the vaccine. And I think that's what's driving this change.
HHS now believes the program was never intended to cover injuries like SERVA. It insists the problem is how the shot is given, not the vaccine. A shoulder surgeon at Johns Hopkins School of Medicine sent this letter to the Secretary of HHS strongly disagreeing. And an attorney who worked for the Department of Justice on vaccine injury claims for 30 years accuses the government of changing its policy to alleviate the workload. SERVA now accounts for 54% of all claims filed in the program.
I think the timing of this is very suspicious.
Because right now, COVID-19 has captured our attention. Doctors are distracted, as are the nurses and pharmacists that would suddenly be open to vaccine injury lawsuits if SERVA was removed from the program.
It would make physicians, I think, say, I'm not giving shots anymore because I don't want to be liable.
Debbie ended up with a tear in her bicep and rotator cuff. Surgery eased the pain, but she may never get back her full range of motion. She says the proposal to remove SERVA from the program is offensive.
It takes all of us, puts them in one bucket and just says, you're not worth what we're doing. To just start fresh and eliminate things that they feel are just too much work is an insult to all those people.
That oversight board did hold a special meeting to hear from HHS and ask it a few questions about why it wants to do this. No one from the department showed up, nor has HHS answered any of my questions or emails.
When we return, some thoughts from the class of 2020.
It's hard to transition into this next part of life without a kind of chapter finale or ending.
2020 will be remembered as the year when everything changed, and no one understands that better than the college graduating class of 2020. Instead of packed stadiums, they're celebrating their accomplishments in Zoom conference calls, circumstances they never could have predicted when they started college 4 years ago.
It's hard to transition into this next part of life without a kind of chapter finale or ending.
It's pretty scary graduating basically at the worst time possible in this past 100 years. I'm fearful that the economy is going to take a massive hit and no one's going to be hiring, and I'm going to have a really hard time finding a job, and I'm going to live at home with my mom forever.
It seems like most companies are in a hiring freeze now.
You could still send stuff out. No one's focusing on that right now.
I could potentially and probably will be agreeing to work at a campus that I've never set foot on. It's really intimidating.
It sucks. It sucks. There's really nothing to say besides that. Just to me, it's kind of a major letdown.
You kind of grow up, you hear and go to college and you get that degree and you're going to be on the stage hearing your name called in front of everybody, showing your parents you made it.
Even next year, if they want to push it that far, I want to do that. Like, I think I deserve to do that.
I'm the first person in my family to get a degree that's not like past a bachelor's, like a higher degree. So I was really looking forward to that. And unfortunately, I'm not going to get to walk now.
Is there anything I want to share with my fellow senior class? Yeah, we got screwed.
Proud of what you've accomplished?
We made it. You're not forgotten. Your graduation matters. Your accomplishments matter.
The class of 2020, we truly are different. And when the time comes, we are going to make a bold impact on the world.
Thanks for watching The Reveal, the nation's only weekly local investigative show. We'll see you next week for another episode of The Reveal.